Okay, Justin, it's really good to have you on the show. Welcome to Beyond MD. It's great to finally connect with you.
Thank you. Happy to be here.
So, Justin, just tell me, are you based in Vancouver?
Just outside, actually. Fun
Yeah.
fact, the birthplace of British Columbia. I'm in Fort Langley.
Oh, very nice, very nice. Yeah, so Vancouver has a very fond spot in my heart as well. So that's where I did my 4 years of medicine. So I graduated in 2010, and I try to go back once every couple of years. A lot of friends still there, so it's a very meaningful place to me. But Justin, before we get into the topic at hand today, just take some time to tell us about who you are and what you do.
Yeah, thank you so much. The first thing that I'll say is it's very, very important, especially with today's conversation, for me to note that I am not a tax advisor. I am not an accountant, CPA, or anything like that. By trade, since 2016, I am a licensed life and health insurance broker. And so I have a lot of these conversations on a day-to-day basis about HSAs, other types of group benefits, group savings plans, individually or corporately owned life, disability, critical illness, that type of thing.
Okay, very good. So I wanted to bring you on today to talk about health spending accounts, so the so-called HSA. So Justin, just maybe give us a quick summary on the HSA. What is it? How does it help us be a little bit more tax efficient? And then we can dive into the details.
Sure. So an HSA pays for personal health expenses
Hmm.
with 100% deductible pre-tax business dollars instead of after-tax personal dollars.
Okay, amazing. So if we wanted to go ahead and do some reading, like let's say on the CRA website, is this synonymous with a private health service plan?
Yeah, PHSP, private health services plans, started in the 80s, and that is right. An HSA, a health spending account, or an HCSA, healthcare spending account, they're both synonymous essentially with a PHSP.
Okay. A lot of people talk about HSAs. When I was first starting the podcast, quick story, I was seeking topic suggestions from my audience, and one of the first topics that somebody suggested 4 years ago was the HSA, and I ignored it up until now. And so here we are now talking about it 4 years later. But it seems like a lot of people will speak about this as, hey, this is a no-brainer. It's a really good thing to do. But before we get into that, let's talk about eligibility. Like, who is eligible for an HSA? What criteria do we need to meet? Maybe we can talk about it first from the corporate side of things, and then, if it's relevant, as a sole proprietor. But what do we need to be eligible for an HSA?
Great. So it's important to note that an HSA would vary depending on a provider that is
Mm-hmm.
selected. There is
Okay.
also the ability to have a self-administered HSA, and if we want to get into maybe some of the precautions in that scenario, but for all intents and purposes, if we're talking about an incorporated professional who's looking at an HSA, they're going to be in one of two positions. They're going to be in a position where they do not have any employees, or they're going to be in a position where they do have employees. So, talking about an incorporated professional that does not have employees, generally what you're going to find in the industry as best practice is that individual owner operator is going to be drawing T4 income from their corporation in order to be eligible. Now, CRA does not explicitly state that T4 is a mandatory requirement. Originally, when they did post their bulletin, there was
Mm-hmm.
that specific language about
Mm.
T4, but soon after they revised that bulletin and removed that portion of T4. Now, best practice, talk to your tax advisor, but best practice is to have T4 because in order for an HSA to be eligible, in the eyes of CRA, it needs to be deemed as an employee benefit and not a shareholder benefit. And one of the most sort of bulletproof ways, if you would, to prove that you are an actual employee of your own corporation is through T4.
Okay. I'm really glad you said that. Now, maybe I can use my own situation as an example. So I'm incorporated, And as things stand now, I'm the sole shareholder of my corporation. So technically, I'm the sole employee, and I would be a non arm's length employee if I'm understanding the lingo properly. So am I eligible to set up an HSA through my corporation and then basically use that to cover things like dental work, optical work, things like that?
Absolutely. In the situation that you're describing, owner operator, no employees, incorporated professional. The language that you're using about arm's length employees typically is going to fall into the category of if somebody is talking about doing an HSA for sole proprietors, which, to be honest, and for your listeners, I don't do that. There are a lot of different rules and regulations for HSAs as a result of being a sole proprietor, so I focus on working with incorporated professionals only. But to answer your question, yes, absolutely. And the reason that a lot of folks in your situation might not be doing this already, one, the awareness just isn't there. There's not enough, I think, of these conversations, so there's a lot of confusion if you're actually eligible. And then, unfortunately, as well too, in the marketplace, there's I think a lot more money to be made when it comes to traditional group insurance plans versus HSAs.
Okay, so let's say I don't have an HSA, but let's say if I was to set one up. Now, who in my household could benefit from that? My wife, who's not currently a shareholder, could she benefit? Could my kids benefit? Could other people in my family benefit from an HSA that is set up through the corporation? I'd really want to clarify this.
Yeah, the way that it works is spouses, whether that is married or common law, and children under the age of 21 are the most common eligible dependents that you're going to find. As well, children under the age of 25, if they are in full-time post-secondary education and are financially dependent and living with you, they would also be eligible. And that goes for other relatives of yours, parents, grandparents, that's common. Maybe you have an adult child, above the age of 25 that has a disability and is living with you and is financially dependent. So those types of eligible dependents are there as well. So parents, grandparents, adult children that may, again, like I said, be living with you and are financially dependent on you and are listed on your personal tax return.
Okay. So from what I'm understanding, Justin, is it safe to say that anyone who is your dependent can take part in this plan?
You bet.
Okay, that is good to know. Again, I didn't know that, so that's new information. So now maybe let's shift gears to some of the key services that are covered. I tried to do some digging. I found some documents by some companies who maybe offer this plan. I also went to the CRA website and I saw a document that was titled Eligible Medical Expenses You Can Claim on Your Tax Return. Does that kind of fall into the services that are generally covered through an HSA?
That's exactly right. So all eligible expenses that are covered it's the entire gamut, the entire list that CRA has set out for medical eligible expenses. It's a very long list.
Yeah.
And what is eligible under an HSA is generally going to be broader and more comprehensive than you're going to find in a typical workplace or personal insurance plan. An HSA will cover those things, your common dental, massage, prescription medication, anything that's to do with your eyes, prescription. So an example would be if you have a personal or workplace insurance plan, it will not cover LASIK eye surgery.
Right.
It just won't. It will not cover IVF or in vitro fertilization. Whereas another one too is Invisalign. Very rare that you're going to find that covered but because those are eligible medical expenses on the full list by CRA, those are all eligible inside of an HSA, and other items too. So An individual might be going on a trip to Portugal, for example, and they might buy travel insurance. You can flow that through your HSA. They might be on their own paying for their own type of personal insurance plan, or contributing through a workplace plan. Those premiums that they pay can also
Yeah.
be claimed through an HSA.
Okay, I want to pick away at some of those things. So travel insurance. So interesting. So I recently did go to Portugal, and we were talking a bit about travel insurance. So if I wanted to get travel insurance for my trip, I could do that through an HSA.
Yes, you would. We'll get more into, I guess, the workings of how an HSA works. But for all intents and
Yeah.
purposes, yes, you would pay for your travel insurance. But like I said right at the beginning, so instead of paying for your travel insurance with after-tax personal money,
Mm-hmm.
what you would do is, that's how it starts. So you buy it,
Yeah.
and then you claim it through your HSA, and now you have turned it into being paid for with pre-tax corporate money,
Mm-hmm.
and now it's 100% write off to your business.
Okay, very interesting. So you mentioned a few other things in there, like IVF. I wanna just go through a small list of things that
hmm
I still have questions about, even after going through some of CRA's documents. So IVF is covered through an HSA. Is
Yeah,
that
again,
right?
so the HSA is slightly different than the medical expense tax credit, where the medical expense
Mm-hmm.
tax credit is sort of different, varying by province, whereas an HSA doesn't really follow those same
Mm-hmm.
guidelines. So, for instance, in Ontario, and BC is going to do it in the middle of 2025, I think, but in Ontario right now,
Mm-hmm.
the first round of IVF is covered.
Mm-hmm.
So you wouldn't be able to claim your first round through an HSA if you're in Ontario, because that's covered through the government.
Mm-hmm.
But maybe you need to do a second or a third or a fourth or a 10th round of IVF. All of
Mm-hmm.
that,
Mm-hmm.
permitted to the limits in your HSA, could be covered by your HSA.
What about contact lenses, glasses covered through an HSA?
Anything prescription
Okay.
contacts, prescription glasses,
Okay.
prescription sunglasses, like I said, LASIK eye surgery.
Okay. Cosmetic work, Botox. I went to the CRA website. Not that I do it, but I know a lot of people who take part in this, and they seem to say if it's done just for cosmetic purposes, maybe not covered. What I'm hoping for some clarity on this.
If it's done purely for cosmetic purposes, 100% not covered.
Okay. Okay.
A lot of people are doing Botox as a result of migraines and other eligible medical reasons.
Yeah.
Highly likely those will be covered.
Vitamins are not covered, right?
No. So all prescription medications are covered. Over the counter, non prescribed,
Okay.
not covered.
And you mentioned massages are covered?
Yeah, as long as it's done by a registered massage therapist.
Okay.
So sometimes there's a massage school that might have a student program running, and they're offering $20 massages by students who are not RMTs. Those types of services would not be covered. But as long as it's an RMT, absolutely.
And exercise equipment not covered, right?
No, maybe we'll get into a little bit later about like a wellness, lifestyle, or
Sure.
taxable spending
Sure.
account, but that falls into the same category as vitamins, or
Okay.
or even as well to cosmetic. Cosmetic.
Okay. Okay, perfect. Yeah, we'll get into that towards the end. Now, let's say I go to the dentist and I get some work done and I get a bill. So maybe can you take me through that scenario? Like, how would I get reimbursed for that, and how would my HSA kick into place?
So there's again, depending on the provider that you've chosen to go with, there's, in my world, two real ways that this is going to happen. So the first way is virtually automatic and seamless for the employer. Again, in your
Mm-hmm.
situation, we're describing the employer and the employee are the same individual, right? So we'll just go
Mm-hmm.
with that. The way that would work in the first scenario is you go into the dentist, you as the employee pay for the service personally.
Mm-hmm.
You then submit that claim either through desktop, but mostly on the mobile app that you will
Mm-hmm.
have access to. That claim will then be adjudicated basically processed, made sure that it's accurate, all the information is there. And you as the employee, within a couple business days, are going to receive what you paid. As long as you have that amount in your HSA, you're going to receive that back 100% tax-free. And that process that you just did as the employee, paying for it and claiming it, once it's adjudicated, would automatically charge your business account for the claim amount, the administration fee, and any applicable provincial taxes. So that's the first way. So very seamless. Simply put, you pay for your service, you submit through the mobile app, you get your money back tax-free, and then you would, whenever you want, log into your business bank account and you would see the deduction.
Okay, that sounds pretty straightforward. Now, can I make claims retroactively? Like, let's say I'm going to the dentist tomorrow, but then I set up an HSA a month from now. Can I claim retroactively?
So just before I jump into that, I'll just quickly describe the second way that it might work. So the second way, there's a little bit of an added layer. So it would start the same. You as the employee would pay for the service personally and submit the claim. But then you as the employer would need to manually pay the HSA provider the claim amount, the administration fee, and the applicable taxes via online banking. Or it might be automatic if you chose to set your account up as a pre-funded account, and then they would just pull the money there. And then after that's done, you would receive your money back as the employee 100% tax-free. So the second one that I described, a little bit of an added step, still awesome in terms of all the tax savings. The first one I described, pretty seamless and quite automatic.
Okay, Justin, thank you for that. Now, people's situations can change with time. We may enter a stage later in life where we need more coverage and we're spending on more things related to our health. So, like, how much coverage are we allowed or entitled to through an HSA, and does this limit change with time, change with age at all?
No, it doesn't limit change with age. It would be great if it did, because to your point, as you age, you might require more, but no, it doesn't. The CRA is not explicit on what maximum levels. Their language is it must be reasonable. And so what you're going to find, sort of best practice industry standard, is no more than about $15,000 per year per person. And say your situation, that would be no employees, 15,000, and that whole 15,000 would be for you and all of your eligible dependents to use sort of as a pot between all of you.
Okay.
You're also going to find some individuals saying you'd sort of take the T4 income and go no more than 15% of that T4 income as the maximum allowable. And then there's another layer beyond that, which is if you are dealing with the owner, you simply don't take that 15% of T4. You would have to essentially say, in order to arrive at a reasonable amount for an owner, you would basically take what would the salary be for this individual if the owner was going to hire somebody to do the job. Okay. And whatever that salary is, you would essentially go up to no more than 15%.
Okay.
Long story short, $15,000 is sort of the average.
Okay, that sounds like a easy to remember, safe number. Now, let's say 1 year I only used $5,000. Can I roll over that money? And let's say I have a year where unexpected things happen. Can I use $25,000 the following year without raising any eyebrows? What's your take on that?
Yeah, so when you set up the plan, you're going to, generally speaking, have the choice to allow carryover or rollover or not. Okay. And that, when you do, it is only for 1 year. So in your example, it would be 25 that following year. And then if you didn't use, that amount, then it would fall off. So the rollover carryover is only for 1 year at a time.
Okay, good to know. Now, maybe we can talk about some ways to customize these plans or to add on features. And maybe this might be a good spot to talk about the wellness spending account, or the WSA. Any useful information is appreciated.
So a wellness spending account, otherwise known as a taxable spending account or a lifestyle spending account. From the employer's standpoint, it basically operates the same. All eligible claims that are made become a deduction, 100% deduction to the business. The two biggest differences that we've talked about is what is and is not eligible. So a wellness is essentially everything outside of an eligible medical expense.
Mm-hmm.
And because of that, it is a taxable benefit. So in your scenario, for example, let's say that you have an HSA of X amount and you have we'll call it a WSA, wellness spending account of X amount. And that wellness spending account, you've given yourself $1,000. And you've claimed $1,000. That whole claim amount is now a taxable benefit that you need to include on your personal taxable T4. Versus an HSA, it's a tax-free benefit to the user, to the employee. So one's taxable, one's tax-free.
Okay, so where could a WSA be useful then? And so if it's a taxable benefit, can you help me just understand why that might be useful for somebody?
So when I had an accountant ask me this a couple months ago, he basically said, so what I'm understanding is, what's the difference of me giving somebody $1,000 in a wellness account versus $1,000 annual bonus? And if we're talking about dollars and cents, there's not that big of a difference. It's virtually kind of the same thing. Where wellness accounts are becoming increasingly popular is when a business does have employees and already does have a group insurance plan, already does have a health spending account, already does have a group RRSP, and they're looking for other ways to attract and retain talent, but moreover are looking to carve out a particular type of culture within their organization. Because you might give somebody $1,000 bonus, and just as an example, they might say, we're talking about construction workers, nothing against them, of course, but let's say that they're going to spend it on maybe cigarettes or beer, but you want them to take care of their health. You might, instead of giving them a bonus, put it towards a wellness spending account.
Gotcha. Yeah, that makes sense. Anything else around customizing a plan to tailor it to one specific situation that we haven't touched on yet, Justin?
Typical add-ons are going to be emergency travel, medical. You can add optional life insurance, optional critical illness insurance. Some have pet insurance as an add-on. Increased mental health support services as add-ons. That's very, very, very popular. The biggest way to customize a plan, generally speaking, with an HSA is when we are talking about an incorporated professional that does have employees. And how this customization happens is through what's called classing, which means owners are going to get X amount per year. Managers are going to get Y per year. And then all other eligible employees are going to get Z amount per year. So you could create different amounts within different categories or classes.
Okay, good to know. Now, if we are going to go ahead and set one of these up, it's a new topic for a lot of people, Justin. So who are some key providers that we could maybe look to talk to? What are some key questions we can ask? And then cost. Like, this can't be free. I imagine there's got to be some kind of administration fee behind the scenes. So can you give us some guidance on the setup addressing those key parts?
Yeah, there are a lot of options, and I think the number one question to ask is sort of on your latter point in terms of what are the fees? And fees are going to come in the form of, to your point, administration fees, setup fees, annual fees, ongoing maintenance fees in terms of costs to add or remove people from the plan. There might be cancellation fees or cancellation penalties. There may be a provider who requires you to, like I said, pre-fund the account, which in today's high interest market could have a bigger negative impact than one might think on the surface. So alternative to a pre-funded account would be looking at a provider that does more of a pay-as-you-go, meaning if you don't use it, you don't pay for anything. So those are some of the questions to ask in terms of costs. I'll give you 3 providers off the top of my head in no particular order. My HSA is one, Easy HSA is another, and then Olympia Benefits is another. And with each of those, there's going to be different setups, different administration fees, different pros and cons, if you would.
Okay, the ballpark costs per year. I looked at one provider, maybe it was Easy HSA. I saw something around annual administration fees of maybe $200, $250 a year. Does that sound right? Does that sound like it's in the right ballpark, or are they typically more than that?
So if we're talking about Easy HSA, the way that they work is through advisors purely on an introductory basis. Advisors do not partner with Easy HSA to earn revenue. They simply send their clients to Easy HSA because Easy HSA charges a flat 5% administration fee on claims, and that's it. Whereas My HSA, they charge 5% as well, and then the advisor is able to earn revenue by increasing that administration fee to their heart's content, whatever amount that they would like. It is important to note that the claim amount and the administration fee are deductible to the business. And good then Olympia Benefits might be a little bit unique for those listeners that do not have employees, because Olympia Benefits offers a 0% administration fee. And they're able to do that because, unlike, as aforementioned, Easy HSA or My HSA, Olympia will charge an annual fee, but they have a 0% admin fee. So it's really case by case. What is somebody looking for? And hopefully, there's other folks out there like me who are going to sort of present all the different options.
So apart from the cost with these plans, are there any cons? Like, are there any situations where you would say this is probably not a good idea?
If you're using a reputable HSA provider, it's quite difficult to really mention any cons, aside from, of course, possibly fraudulent claims, which when you're using an HSA provider, they can spot those things. But where you would find fraudulent claims would be in the sense of like double dipping, maybe making a claim through an insurance plan and the full amount through an insurance plan and through an HSA. So, of course, fraud is fraud, and that could be looked at as a downside. There's not really many cons, to be honest. If somebody does have employees, they might spot a negative intended consequence where they give employees X amount per year, and then they hire somebody and they're eligible, and then they use all of it right away, and then they leave the company. There are ways to mitigate that, where you can, instead of giving the full amount right up front, you can kind of drip it out on a semi-annual or a monthly basis. Misuse.
Yeah, that was my next question. Like, in your experience, apart from things like double dipping or maybe trying to claim too much, have there been other scenarios where the CRA has come back and said, you know what, we think this HSA is being misused?
Yeah, it's really going to come in terms of non-reasonable plan limits. Other misuse would be in the situation where you do have employees, and it's known as anti-selection. So maybe you have employees and you're only offering the HSA to yourself and your favorite employee, but you also have 3 or 4 employees who are in the same role. You would need to offer it to everybody who's within the same sort of class.
Right.
But I guess back to the question about cons, I forgot to mention in Quebec, it could be looked at as a con. Quebec is unique in that HSAs are treated as a taxable benefit. So that's one thing to look out for if you're in Quebec. And then, like I mentioned too, some of the cons might be looked at as sort of the ongoing maintenance fees that maybe you weren't aware of in the beginning when you sign on with a particular provider. Um, and then I guess another con too possibly is because HSAs, in order to be eligible, they have to have a reasonable level of risk, meaning there needs to be a cap on the amount that's able to be used throughout the year.
Hmm.
And because they come with a cap or a maximum, there might be some situations where somebody does require a certain type of medication that's very high cost because of a chronic illness or something like
Hmm.
that, where maybe an insurance plan could outweigh the benefits of an HSA.
I think that's a really important point. Thank you for sharing that. Now, did we miss anything, Justin? Anything really important that we haven't covered yet on HSAs? I just want to make sure we hit all the big points.
No, I don't think that you asked a lot of great questions. We don't know what we don't know. I think maybe I think you asked this question, and I had to double back, and I think we may have missed it. And I think you were asking about retroactive claims.
Yeah, yeah.
And the short answer is no. It's treated like an insurance plan in the sense that you can't buy house insurance when your house is on fire. So um, going retroactively, say you started a plan today and you had your child's braces payment from any time a day
Hmm.
ago or a
Hmm.
year ago, and you wanted to make that claim, that's the quickest way to throw up a red flag with CRA and have the whole thing unwound and unnecessary fees and penalties and taxes associated with it. So, for all intents and purposes, no backdating.
Okay. I didn't ask this. I just thought of this, but there's no need to prove health before you sign up for an HSA, right? It's not.
No,
It's
that's
not
one of
like.
the best benefits is it's not insurance.
Mhm.
And so there is no conversation about pre-existing conditions whatsoever. There
Okay.
is no conversation about being declined whatsoever. There is
Okay.
no there isn't even really in the true sense when you're having conversations about benefits, there is really no application. It's how much money do I want to set up for me and or my employees? What type of provider do I want to work with in terms of the
Mhm.
fees and everything else? And we're off to the races.
Okay. That sounds good. Now, one listener did ask me a question. I thought this might be a good platform to ask it, but for example, we have something called OPIP in Ontario, so OMA Priority Insurance Program. This is offered by Manulife, and it covers dental, drugs, vision, and you can opt in if you want to. But is these provincial plans, are these something that we can be paying for through our corporation, or is it something that typically should be paid for personally? It was a question that was posed to me. I didn't know the answer, so I thought I would just bring it up here.
Yeah, again, not as a CPA, but the answer is yes. So you could have your corporation pay for that type of an insurance plan, or you could
Hmm.
pay for it personally.
Okay.
So that's sort of one part to the question. And the second part is, let's say that you are paying for that type of coverage personally, and you then set up an HSA.
Hmm.
Like I mentioned earlier, you can take those premiums that you're paying for your own health insurance and claim it as an eligible medical expense through the HSA,
Hmm.
permitting that it is for the health and the dental portion of that coverage. Some of these types of plans that you're mentioning offer additional, maybe critical illness or life
Hmm.
insurance or
Hmm.
disability insurance. You cannot claim those through an HSA, but for the health and the dental, you can.
Okay, Justin, as we wrap up, any closing thoughts? It could be on HSAs, it could be on anything else. We connected, I think, several months ago on LinkedIn, and I have to say I've enjoyed following you. It's been good to connect with you, but anything that you wanted to share at all?
I kind of, I guess, just going off of your last comment, for your audience, likely a lot of incorporated professionals, possibly
Hmm.
without employees, there are ways, like you said, to pay for your health insurance through your corporation, also your life, disability, and critical illness insurance through your corporation. Of course, there are nuances and a broader conversation to be had, but wanted to mention that that's available too. And then yeah, like HSAs, You don't pay unless you use it for the most part. And instead of paying for health expenses for you and your dependents with high after-tax personal money, you're paying for it with pre-tax corporate money and getting a write-off. It's hard in today's world with all the information and misinformation to really quantify something as a no-brainer. But I'd
Yeah.
have to say that this sort of fits that bucket, fits that bill.
Yeah, yeah. There's certainly a lot to like when we talk about HSAs. But Justin, I want to thank you for your time. It's been great to connect and chat with you today.
Thanks.